Kids who have Sever disease often complain of pain right at their heel, and that's what you're going to notice. It's often with activity, running, jumping. It's not usually associated with some sort of big traumatic event like jumping off of a wall or falling out of a tree. It could be really something as simple as just getting kicked or stepping the wrong way. A lot of times the pain is there at baseline, and then something acutely aggravates it. Often we see in our young athletes is during the off season when they're not doing a whole lot, they're usually feeling okay. But when preseason starts and they get back into the flow of whatever sport or activity they're doing, that's when they often can complain of this kind of nagging pain that causes them to limp. Sometimes you can see it in both heels, or you see it on the left side for a little bit, then you see it on the right side. And it's mostly due to the fact that a lot of weight tends to go through your heel when you're walking, jumping, and running. And the heel bone, before it's fully fused and fully bone, has a lot of cartilage in the back. And right where your Achilles tendon comes down your leg and inserts onto your heel bone, it's a huge growth plate right there that's mostly made up of cartilage. So when you're pushing off or pushing down your toes or jumping, your Achilles tendon is constantly pulling on that growth plate. And there's a little bit of micro motion. You're not going to notice it, but there's a little bit of micro motion and inflammation that happens. And that's where the main source of the pain comes from. Most of the time, we're just going to modify your activities and ask you to back off from sports and activities a little bit and take breaks and rest from time to time. We often have kids take anti-inflammatories and ice their heels after they've done playing. And, we can even take these little gel inserts called heel cups and put them into your shoes to help with the impact and the loading and the landing that happens a lot with sports and jumping and running and such. And these heel cups are nice because you can move them in between, different types of shoes and sneakers into your cleats. They're not really fixed into one pair of shoes. So you only usually need one pair. Although every 6 or 8 months or so, we usually recommend that you get a new pair because they do tend to get worn out as you're active and as you're growing. Now, in certain situations, if kids have really tight calf muscles or Achilles tendon heel cords, we will send folks to physical therapy to ensure they get their heel cord stretched out, their hamstring stretched out, their calf muscle stronger, because all of this can help with the force that's going through the heel bone and really minimize their pain and their inflammation. Some things you can check for to see if you think your child may have Sever's disease is they're going to have pain if this is their heel bone, if you squeeze on both sides of the heel like that, this is their foot and their Achilles tendon and calf is going up. When you squeeze on their heel bone like that, you're definitely going to you're going to get a lot of pain. If it is Sever's disease, you can tell if their heel cords are pretty tight, or if you watch them walk, you may notice that they're not really wanting to put their heels down as they're limping along. You shouldn't really see a lot of redness or bruising or any open wounds or anything, but definitely soreness, pain, a tight heel cord, and not really wanting to put their heel down are all signs or symptoms that they could have Sever's disease. Another thing to realize with Sever's disease is that, it changes with the kids. So you may find that the kids have it for a couple of weeks, maybe a couple of months, they deal with it and it goes away and they're even compliant with their stretches and their activity modification. But then they grow 6 inches and they gain 30 pounds and they're now, 14 instead of 11. And now they're a different person. And, we can see these things come back, not necessarily because of any fault of their own, but it's just now that the forces have increased again, their growth plates may still be open, and it may be something that they see again and deal with prior to reaching full skeletal maturity. Sometimes there are worrisome signs or symptoms that your doctor or your provider will notice on examination, and they may want to get an x-ray to rule out like a stress fracture or a stress reaction in the bone or some sort of cyst or infection in the bone. But these are going to be, but those sorts of things are pretty rare. And you can leave it up to your provider. Um, and by and large, most kids with heel pain don't usually have those sorts of conditions. The main thing that you do need to realize about Sever's disease is that it's not necessarily a bad thing. It's something that happens to a lot of growing kids who are active in sports and different activities. It's not anything that you necessarily have to see a specialist or a surgeon for. If you do make your way to see us, we're just going to chat with you and reassure you and examine you and make sure it's not anything that we do need to worry about. But all in all, it'll just be a visit where we can answer some of your questions and just make sure that your child is doing okay.